Welcome, everyone, to Homeless in San Diego. I am Greg Angel, joined today by Phylicia Applewhite. Welcome, Phylicia.
Thank you for having me.
We met in the hallway at the big Regional Task Force on Homelessness conference down in San
We
Diego
did, we did.
late last year. And I was surprised to learn, though, that we probably should have met a while ago because you've been working at the Regional Task Force on Homelessness for
Almost 5 years now.
congratulations.
Thank you.
Yeah, yeah. So share a little bit about what you do at the task force. We're going to get more into it later, but just so our listeners have a sense of what the work is that you what you do for a living.
I am the Senior Coordinated Entry System Specialist at RTFH, so I do all the housing referrals in San Diego.
All right, senior coordinated entry systems specialist.
Yeah.
Those are a lot of words, a lot of syllables. We're going to get to it though, and to our listeners are going to understand kind of the heart of what matters and how you are the heart that keeps the system operating in ways that are so important. Um, Before we talk about the work, more about the work that we do, one of the ways that we connected was because you have lived homeless experience yourself. Can you tell us a little bit more about yourself? Who's Phylicia, and what your life has been like to now, and whatever you would like to share about your personal experience with homelessness.
Okay, sure. I am from San Diego, born and raised. I left maybe in like 2008, 2009 when I was younger and came back in 2014. Um, and I've been doing my thing ever since. I got into nonprofit work maybe about 4 or 5 years ago, and I've loved it ever since. My experience that I have experienced homelessness kind of throughout my life,
Mm,
as a kid and then a little bit as an adult. Actually, before I started working at RTFH, I had just resolved my own homelessness. It was like that first year of
wow.
resolving my own homelessness, and then I started working for RTFH. So
Were those two connected? Did you want to move into this field because of that experience? What role did that play?
So I was working at 211. That's where I started. I started as a community connector
Hmm.
and I worked the county line. So
Oh,
that's
okay.
where it started, looking into, CalFresh cases, seeing how that system worked.
Mm,
And then I wanted to change things up a little bit and RTFH was hiring.
yeah.
So I just made the move.
And so within a year of an experience with homelessness, you were working for the the organization the in charge regionally of coordinating all the systems and programs and efforts around reducing homelessness.
Yeah. I didn't really know about what RTFH did except for they are a partner of 211.
Hmm.
So I was, as a community connector, giving resource information about RTFH.
Were there any elements of your own personal experiences, housed or otherwise, that inform and have informed what you do at the Regional Task Force on Homelessness?
Yeah, my whole lived experience. Just learning, I think when I was younger, not knowing the system, my mom knew the system very well. So she was able to kind of maneuver throughout the system. And then as an adult, I knew about systems. I just learned how to maneuver through it. And so when I was just recently, before I resolved my own homelessness, I just knew the questions to ask. And I knew what would happen if they didn't answer those questions, the escalation, right? Situation kind of sticks out to me the most. I was homeless and I had my second child, and we were in the county office. And I knew from previous experience that I could get daycare, but I didn't know that it was voluntary. Nobody informed me that it was voluntary. So when I
Mm,
was there, I was just like, I need this resource. They were like, you don't need it. Come to find out, if your child is under a certain age, they won't require you to do it. You have to volunteer yourself to do
mm,
it. part of the Welfare to Work program.
Hmm.
And so there was a miscommunication about what I could and could not do, which was kind of detriment because, the county, you have a timeline to kind of meet. And and it was hard to kind of get the information, but when I got it, then I just held on to it and I knew, okay, moving forward, if I ever use this again, I have to volunteer myself.
Wow. That's a
Yeah.
powerful story because I think about changes that are happening in systems now. We're recording this in early 2026, and changes to CalFresh food benefits are going into place, requiring so called able bodied adults to work at least 80 hours a month. They're also going to be required to reauthorize their approval to receive those benefits now every 6 months. And so a lot more people just on the food benefits piece, which in San Diego County is more than 400,000 people. It's a lot of people, right? Are now going to have to be going through a different part of this system every 6 months in order to just maintain that benefit. And your story highlights that, how information is shared or is not shared in that process
Hmm.
can be the difference between whether you have childcare or whether you're getting food on the table for your family.
Yeah.
Wow. Um, you mentioned your own homeless experience that you resolved it yourself. Can you share a little bit about what that resolution looked like and um,
Yeah.
how you're able to? Because that's a challenging thing, as you
No, it
know, to
is. It
overcome.
was definitely very hard, but I just got tired. I just got really, really tired, and I just was not going to take no for an answer anymore. And the what the situation was, I had an eviction from like 10, 11 years ago
Hmm,
that was literally preventing me from renting,
really?
essentially. Yeah, so I had to figure that out. That was like a whole situation in itself because since it had been so long, the people who owned the apartment complex didn't own it anymore. So
So that you couldn't go back and
yeah, so
explain or
I
get
tried to go back to like the lawyers and
yeah,
say,
yeah.
"Hey, how do I get this resolved?" And it was a year process
Hmm.
just to get that resolved. I mean, it was back and forth. They said they weren't going to take it even if I sent the money that I owed. They were going to
Hmm.
send it back. So I'm just
Hmm.
like, "How do I fix this then?"
Yeah.
I never knew it was going to be so hard to like pay what I owe.
Right.
Um but what I ended up doing was if nobody was going to take it, nobody could find like the owner. So because it was in court, I just went ahead to get it dismissed or get it like, some type of movement. I
Yeah.
figured if I filed and notified the parties, maybe that could get it going. And that's kind of what started it. They denied my request to remove it or, whatever. And the lawyer reached out to me, same lawyer I called earlier,
Hmm.
and let me know like this is how it's gonna go. So I was able to pay it. And then there was the tricky part of it being on my credit report. And it was right before COVID. And I got the paper that said it was paid, all of that stuff. But because it's a system and Rent Cafe is what all apartment complexes use,
Hmm. Hmm.
if it ran one way, it was gonna go like that for every single one. So I did like 5 apartment complexes applied. Mind you, $45 to $50
Per application.
yeah,
Yeah.
for the application, and then after a while, just like, "This is not gonna work." So, right before they closed down, right before COVID, I reached out to the clerk, and I was just like, "Look, I'm gonna be homeless if I can't get proof that I paid for this. Um, I know it's probably just sitting in a stack because during that time, things were, like, kinda slowing down and stopping,"
Yeah.
and the lady was nice enough to email it to me
Hmm.
so I can show proof. But then it was a little hard then because they're like, oh, the apartment complexes were like, we can't, it's the way the system is, we can't override it. And so then I was like, okay, knowing that I have it like paid, some apartment complex wouldn't work with me, even though I had the court papers saying
Yeah.
that it was paid,
Yeah.
except for one apartment complex. And they're like, yeah, it's paid. It's been a long time.
There you
I was
go.
just like, "Cool." And I paid, my little deposit, and I was in that day. I almost didn't even go because I was like, "Oh, they're gonna tell me no again. Oh, I don't wanna hear no."
Isn't that something?
And then something just told me to go, and I went, and they were like, "Yeah, you're approved."
Wow.
I was just like, "No way." I was like, "I wasn't gonna come
Right?
today."
Such a gift.
Yeah, and that
Such
was
a
the
gift.
beginning of good stuff.
I'm thank you for telling that story. Right. Our listeners may have heard an episode we did last year with single dad Elvis. And in his story, his experience, he lost his wife. She had a heart attack and she died. And they have two little girls. And he realized he couldn't make ends meet. And he made the choice to leave his apartment because he understood the system you're talking about.
Yeah.
And he knew that if he ended up with that eviction, it's like it's lights out.
It's almost a death
You're
sentence.
not going to get another apartment, right?
Yeah.
And so he made the really challenging decision to do that. And I've been sharing his story with a lot of people recently, as ways to illustrate kind of what's going on. And what I've found is that a lot of people don't understand that system, and they're like, "Wait a minute, why would somebody just leave? Why wouldn't they try to work it out?" And I think a lot of those people don't have that experience of knowing what that impact is going to be. And that's just one little thing,
Mhm.
right? The eviction, you talked about the credit score,
Yeah.
you talked about kind of institutional landlords where, hey,
Mhm.
even if you show that it's paid,
Yeah.
they can't override that system,
Yeah, it's
right?
crazy.
Yeah. Yeah.
And I had no other eviction, no other derogatory anything. I didn't owe anything to anybody else. I was just like, "What?"
Mm-hmm.
This one little thing that
Mm-hmm.
happened almost 11, 13 years ago is like
Yeah.
stopping me now.
Before we go to break, I want to read something you posted on LinkedIn a few weeks ago. You posted about the power of learning systems, and in the post, you say learning the system does three powerful things. It removes fear. Clarity replaces anxiety. It restores agency. You can ask the right questions and document the right things. It shifts outcomes because systems respond to process, not emotion.
Very true.
These are wise words. Wise words,
Very true. It's
Phylicia.
what I've learned so far. And just learning how to understand the systems that I go through. And sometimes you can't dismantle them. So it's better to join them sometimes.
I have been saying a lot recently that here at Interfaith Community Services, we work within broken systems. And as much as we would like to tear down and rebuild those systems, and in some cases we do advocate and work for that, we have to, if we're going to be able to deliver the help that we're seeking to deliver to our community members, we have to work within those broken systems, as challenging as that is.
Yeah. It's very challenging, but there's nothing wrong with asking questions. When I worked in 211, I would always tell people I always suggest using the jargon that they use, if you need something from them, instead of going and say, "Hey, I need this," say, "Hey, I need this current living situation done."
Hmm.
So that they know that you know what you're talking about, and you know what you're talking about, you know? So I think it's good having consent is understanding. So
Mm.
when you understand, you can consent to a lot more.
Yeah, yeah. Education is critical, right? Okay, we're gonna take a quick break, and then we'll be back. We're gonna learn more about the work that you do and how you're helping people overcome homelessness and the positive impact of that. So we'll be right back. All right, welcome back, everyone. I am here with Phylicia Applewhite. Phylicia is a coordinated entry systems specialist at the Regional Task Force on Homelessness. Again, lots of words.
It is.
What can you share a little bit what the Regional Task Force is, and then we'll get into coordinated entry and how you're helping getting people connected with housing.
Yeah, so RTFH is the COC of San Diego County, and
And that's the continuum of care, which means that that's the group that's responsible for money that comes from the federal government to address homelessness here locally.
correct.
Did I get that right?
Yes, you
Okay. All right.
did.
And so RTFH is the working as that continuum of care. But in addition to distributing the funding, RTFH is also doing these other functions, right?
Yeah, correct. We manage the HMIS system and the coordinated entry system for San Diego County as well.
And HMIS is this database of every person who accesses a program like Interfaith Community Services. We have different housing programs, some that provide rental assistance, some that provide actual permanent supportive housing. Others are street outreach programs. These are all programs that enter data in to the homeless management information system that your organization oversees. And one of the really important things that you all do with that is not just report on the outcomes and ensure that programs are effective and fulfilling their obligations, but also to utilize that data to effectively get people connected with the right housing intervention.
Yes.
Is that right?
Yes.
So, can you share a little bit about about how that works, like what coordinated entry is?
So coordinated in this system is, I would say, the regional front door, while the HMIS system is the shared record through all the programs. So it's a collaboration of data. Coordinated entry itself is a living system inside of a mechanical system. So it keeps every client that's entered the heart of everything. San Diego's continuum of care is really unique in the way that it is really person centered. So clients do have a choice to either approve or deny the housing resource that they want.
Interesting. Can you walk me through kind of what it looks like from what a client what a person does to enter into the coordinated entry system? How do they get entered in? And yeah, just kind of like what does that look like for the person experiencing this?
So from the client side of things, you would go to a homeless service provider who is providing services. They would assess you in our assessment. That's the access because there's five components. It's the access. The second component is the assessment. When you get to the homeless service provider, they're going to assess your needs. That's where the VI SPDAT comes in. And then
And the assessment, the VI SPDAT, that's a set questionnaire that's addressing vulnerability and the level of need that somebody has.
correct.
Right? Okay.
Yes. It is a partial component.
Mm.
It is not the full component. So it's just essentially a survey for like immediate needs. Like at this time, what is it that you need? Is it housing? Is it maybe diversion? It's really a way to kind of get to know the client and exactly what it is that they need. The next component is the workflow, which is entering the client into HMIS, doing the workflow, which is including a triage tool, including an enrollment to CES San Diego, and an enrollment to the community queue.
And if somebody comes here to Interfaith Community Services, they're seeking housing, we help them complete the assessment. Is it our team who's then doing the workflow piece or
Yes,
yeah, okay.
yes. That is the provider's part to do the work. In all reality, the coordinated entry system is embedded in HMIS.
Got it. Okay.
So when you're doing the assessment, it'll trigger, okay, you need to do this. And then if the client needs housing, then you would enter them onto the community queue, which is for clients who are actively looking for housing.
And on any given day or month, like how many clients, how many people are in that community queue seeking housing?
A lot. um, I would say roughly in total, what I look at, about a little over 4,000 people.
Seeking housing
Hmm.
right now.
Hmm.
Yep.
Immediately.
Wow. So, I mean, with more than 4,000 people seeking housing, the RTFH puts out monthly dashboards on the outcomes of this work. And so in December of 2025, for one example, there were 1,083 people who got into housing coming out of that queue. So that's a lot of people, if that more than 1,000, right?
Hmm.
It's really amazing that that's happening in a positive way. But wow, I mean, you really framed the level of need when you talk about the fact that, yeah, 1,000 people got housed, but 4,000 people are actually seeking it.
It's really dynamic. It's a really dynamic prioritization list, essentially. That would be the next component of coordinated entry after. The provider does a workflow, it would be the prioritization.
Can you talk about that? How does somebody get prioritized over somebody else, and why do we do that?
So the whole assessment in HMIS, it includes the triage tool of the ISPDAT all in one, and it looks at a wide variety of things, and it scores you. And then based off that score, it'll total a composite number up to 100. And then you're prioritized based off of the information that's in the system.
And then what happens next for the person who's seeking housing?
Once you are, after prioritization, it is referrals. That's when I'll get a request from a housing provider. They'll say they need 3 referrals. I keep all of the eligibility on file on record that I can reference to, and based off the program's eligibility, I make those referrals.
So I'll give an example. Here at Interfaith, we have a permanent supportive housing program for disabled seniors. It's called Raymond's Refuge.
No,
And
I'm
so,
familiar.
yeah, thank you for helping bring people into Raymond's Refuge. So obviously, somebody, in order to be eligible, needs to be a senior,
Hmm.
right? So that's one of the examples of an eligibility
Correct.
criteria.
Or location requirement. Some have to be in the county, some have to be in the city.
Hmm.
Sometimes it is unincorporated areas, sometimes it's specifically El Cajon, North County. So there are sometimes location restrictions.
And so you shared when a provider requests a referral, did you say they request 3 referrals or you
Yeah, so
provide 3?
yeah, so they would request whatever it is they need, whatever
Okay.
their openings are. We send a 1-to-1 match. So if they have a one
Got it.
unit
Okay.
opening, we'll send 1 referral.
Okay. And then next up in that step is client choice,
Yeah.
right? Talk
Yeah,
about that.
it would be so after I send the referral, you get instructions. Everybody's included that's in the care team. You'll get the provider's information. That way you can reach out. The idea is once I send the referral, that's where the real collaboration comes from. The housing provider is supposed to reach out, let them know about the program, maybe intake, things of that nature, and that's where I stop.
You said earlier before we started recording that I asked what you want to really communicate today on the show, and you said collaboration, partnership. Sounds like this is a huge place where that happens.
It really is. One can't go without the other. And I think sometimes people forget we are really all a team just because it doesn't affect me maybe day to day or I'm not working with clients um, front facing, but it does affect the whole system if clients aren't moving off of the list or, the community queue for maybe simple things like,
Yeah.
oh, I didn't get in touch with them,
Yeah. Yeah. Yeah.
you know, things like that.
And the reason why we need to do this prioritization and why we have a coordinated entry system is because we have 4,000 people seeking housing, and about 1,000 people this last month got it. So that means 3,000 people did not. And before coordinated entry system, it was a free for all. And so people would go to it was how many agencies could you go to, how many programs could you sign up for, and then the program operator would then select who they wanted to bring into the program. And so there were all sorts of problems with that system. It wasn't equitable, and it resulted in a disproportionate people getting housing who had the ability to go to all the places and to advocate for all the programs. And so you had a lot of people who were struggling more, had higher levels of disability and vulnerability, not getting housed. And so this is a system, a better way of doing it, but it only works when you have an efficient system, and then you have really smart, caring people like yourself operating it.
Yeah, I mean, you're really in a unique position, having lived experience and being at the helm of system design and implementation. Not a lot of lived experience people get to do that. I think sometimes lived experience are siloed into like advocacy or just speaking, things of that nature. So the fact that I'm in a position where I can implement a system and influence the change in it as well is pretty cool.
That's amazing. Are there any changes that you've made or modifications that you've been a part of helping create in the system?
Yeah, I mean, it started out as 4 people doing this job, and the changes I've made have made it easier for me to kinda take on that burden by myself as a lone ranger to kind of process referrals for the whole county. That just happens with organization, and really planning out my day.
Hmm. How many people are you? How many clients' information? How many people are you kind of interacting with through this work every day?
In any given single day, if the workload is heavy, maybe about 100,
Wow.
close to 100 over and over again.
100 lives that
Mhm.
you're getting involved with and working to get housed every day. That's amazing. Well, I want to share some of the positive impacts of this, of the work that you do, the systems that you're helping to refine and improve, the wisdom that you bring to the role, because RTFH tracks inflow and outflow of this system. So, how many people are getting out of the system successfully? I mentioned in December, 1,083 people got out into housing. The people were housed. That's the outcome we want. At the same time, we had 1,007 people come into the system homeless for the very first time. That's obviously what we do not want. The One of the headlines there, though, is that in that month of December 2025, for this, I think only the second month over like a 12-month period, we actually did get helped get more people housed than came in experiencing homelessness for the first time. And that's the math that we need to do if we want to truly reduce homelessness regionally. We need to get more people housed. We need to have less people fall into homelessness. And there's been some really strong progress towards that in recent years.
No, yeah, I think, looking at the dashboards is just, putting a picture to the work that I do every day, because I don't get to see after the referrals are sent out, I don't get to see the outcomes.
Hmm.
And so seeing the dashboards and realizing, the numbers that are attached to that is pretty amazing.
Yeah, let me give another snapshot at it that is really calls out how amazing it is. So if we go back 3 years, 2 to 3 years ago, over a 12-month period, for every 10 people who got housed, 16 were becoming homeless for the first time. And so when we think about why are there so many more people visibly street homeless, well, that's why. But if we look back over the last 12 months, the numbers equalized. For every 10 people who were housed, 10 people became homeless. And we don't want that. We need to drive down that becoming homeless first time figure. But we're at an equilibrium for the first time in the many years that this has been tracked. And that's remarkable progress.
Yeah, nobody wants to break even, but breaking even is okay. It's a sign that things are moving and that the system is working as it is intended to work, just from a technical standpoint.
Yeah, and we're going to get into call. We're going to take a break, and then we'll come back and wrap up the episode with calls to action and a sneak preview. There's a lot of threats to the progress we're making because of what's happening at the federal level, because of challenges at the state level. So, and all of that impacting homelessness here locally. So, we're going to talk about calls to action and what that means. But before we wrap up this part of the conversation, Felicia, is there anything else that you want to share about your role and the work that you do at Regional Task Force on Homelessness?
I take it very seriously. I'm invested in the clients, the housing providers, and the case managers.
Well, it really shows. Thank you for the work that you do. We're going to take a quick break and come back with calls to action. Welcome back, everyone. We are here with Phylicia Applewhite. Phylicia just shared with us the amazing work that you're doing at Regional Task Force on Homelessness, how you're getting hundreds of people every day uh, into connections with housing. We talked about the positive impact of that, progress made regionally towards reaching an equilibrium where for the first time since we've ever been tracking it, we are getting as many people housed regionally as people are falling into homelessness for the first time. And that's not where we want to be, but it's a heck of a lot better than where we were just a couple of years ago. So we're going to end the show today, like we always do, talking about calls to action. And I wanted to level set that again because it's going to relate to what I'm going to share on a call to action. But it's not my show. I'm just here hosting, facilitating. You are our guest, Felicia. So what are your calls to action? And please share with us what we should be doing.
Okay, so my call to action would be if we want different outcomes, we must invest in system design, training, data quality, and accountability. That's where real change starts.
Amen. Amen. So what does that look like?
That looks like a lot of things. That looks like better collaboration. That looks like asking more questions. That looks like training. That looks like responsiveness. When people are reaching out, looking at your messages. I mean, it's a whole plethora of things.
What do you think we're doing here in the San Diego region that is not only effective, but you think should really be um, replicated, modeled in other communities, and that maybe we should even be doing more of here locally than we are doing?
I I really think the person centered care is the number one thing, because in a system that's really mechanical, people having choices is top tier, regardless of what situation you're in. So I think other COC should implement um, more person centered um, things in their continuum of care. I've seen it a lot of different ways. I've done a little bit of research on coordinated entry in other counties, and we are truly the only one that's really person centered. So I think that is what makes us unique, and everybody cares. Everybody really does care.
And that might speak to it. I was going to ask what makes our coordinated entry system more person centered.
The veteran case conferencing, the general case conferencing, being able to take some of these clients and talk about them in real time.
And work with partners to find the right fit for their
Yes.
situation and provide them the choice of what the right fit is. We're going to be sharing more about this later this year, but we at Interfaith just yesterday, sitting in this room, got a whole bunch of data from personal interviews that have been happening with people who are unsheltered in one of the communities that we're serving. And it was really heartbreaking because we all know that housing is a huge need among our unhoused neighbors, but the biggest need equal to that was talked about in these interviews was not food, it wasn't even safety, it was loneliness, it was disconnection from family, it was feeling like nobody cares about them and not being treated human. um, and you lead a system that if done improperly could really reinforce those feelings, right?
Yeah.
So to be person centered is so it has to be like the alpha and the omega of it all,
It
right?
seems so simple, but it really does boil down to that. I mean, in case management, you have to meet the person where they're at and get to
Yeah,
know them before you can suggest anything. You have to get to know them. So
yeah,
it translates everywhere.
yeah,
And just
yeah,
being human,
yeah, yeah.
just being human it works.
That's a call to action. That's a call to action that pretty much every episode is be treat people with dignity, respect, right?
Yeah.
Help people understanding, and I would offer today, understand that people are lonely and people are feeling disconnected, and so anything that we can do to help connect with people in a personal way, in a human way, in a dignified way is powerfully positive. um, and I would be totally remiss if I didn't speak in our call to actions here around the importance of building just and equitable systems like you spoke about. And when it comes to housing, that means having the amount of resources that we need. You shared earlier this episode there's more than 4,000 people seeking housing right now in the coordinated entry system, and we're only able to get about 1,000 people into housing each month. And each month we have another same amount of people falling into homelessness. So we're barely treading water, if even that. And unfortunately, the federal government is threatening to significantly reduce the amount of funding for housing. The state of California, which has provided um, critical critical funding for operations of a number of interventions, including housing, but also outreach, and temporary housing. Those resources are being cut. And then locally, we're as a result seeing more people experiencing homelessness. So it is a call to action for all of us that there are proven interventions here. We've shared about in past episodes, veteran homelessness, for example, has decreased dramatically.
Yeah, so much so it's hard to find veterans sometimes to send to housing programs.
Right?
Hmm.
What an amazing problem to have.
Yeah, I love it.
Turns out we as a nation invested in providing what? Housing and supportive services for
Hmm.
veterans. And it worked. It
Yep.
worked. If we would commit as a people, as a community, to saying it's unjust and not right for anyone, civilian or veteran, to be homeless, we could do it.
Yeah, I
We could
think
do
we
it.
can.
Yeah,
It may be getting a little bit more creative than what
for sure.
we usually are used to.
I think you're
Um,
right.
and just not using this as why is this happening to us, but
Yeah.
what do we have to learn from it?
Yeah. Yeah. Well, I'm more optimistic now than I was at the start of the episode because knowing that we have creative, passionate, and wise leaders like yourself doing this work, Phylicia, makes me again just feel even more confident that we're gonna get through these challenges and we're gonna be creative and innovative in how we build more just systems and knowledgeable about the broken nature of the existing systems
Hmm.
to best operate within them. Thank you so much.
Thank you for having me. This was so fun.
Thank you for who you are. You are a joy. Would love to have you back on the show
Yeah,
to
sure.
talk more about the work that we're doing, because the system will hopefully be a whole lot better in
It's
the future.
always evolving.
Yeah, yeah.
Always evolving.
Well, thank you for evolving it in positive ways. Thank you for who you are and what you do.
Thank you so much for having me.